Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have a returning guest, Dr. Valerie Mukanga. Welcome back to the podcast.
Thank you. Thank you for having me again, Dr. Kerry.
So, everybody will have to listen back to episode 64 on what we talked about last time and to find out more. But I think today we're going to have another fun conversation. But can you remind us who you are and what you do?
Yes, I'm Dr. Valerie Mukanga. I am the CEO of Healing Wings Dental. I'm a general dentist, and we've been in business for almost 9 years.
Wow.
Excited. And I am located in the big Dallas-Fort Worth Metroplex in Texas. Yeah.
Awesome. I
Mhm.
love having people from other specialties and things like that, and definitely other disciplines like dentistry, so we can bring more information to all of our listeners on how they can be, healthier and better. So thank you for coming back to share your
Oh,
wisdom with
thank you.
us.
Thank you for having me again.
Yeah. So I know we probably touched on it a little bit in the last episode that we did 64, and people can go back and listen, but I wanted to focus more on, what gum disease is and why is it important to talk about?
So gum disease is pretty much having infection at the level of your gum. It can stop at it's twofold. So you have gum being affected and also the bone that's under the gum being affected as well. So when it affects the bone, it has been a progression of a lingering infection over the gum that was not resolved. But it's basically inflammation of your gum tissue, inflammation of your bone tissue that supports your teeth. So that's what gum disease is.
And what are the fancy terms that we might hear that describe this?
Okay, so you would hear gingivitis and you
Mhm.
would also hear periodontitis. So gingivitis is when the infection is at the gum level. And then periodontitis is the progression of gingivitis that has now affected the supporting bone of
Mhm.
the bone supporting your teeth. And so when that is affected, now it's called periodontitis. And usually when you have periodontitis, it also has gingivitis as well.
Yeah,
Yes,
that was going to be my next question. Does the gingivitis lead into periodontitis typically?
that is correct. So gingivitis is going to be the precursor, and then it leads to periodontitis over time.
Okay. What are some sort of signs or symptoms that a patient might, feel or experience to think that they might have something wrong with their gums?
Okay, so yes, there are some telltale signs of having inflammation of your gum tissue. You would see, and many people can see that when they're brushing their teeth, the gums are bleeding.
Mm.
That is a sign, a sure sign that you have gum disease, okay? So when you see that you're bleeding on brushing, because it's like if you scratch your skin, you won't have any bleeding. But if you have a problem and you scratch, then you see bleeding. So anytime you see bleeding, it's a sign that there is something going on your gum. It's a sign that something off is happening. And most of the time, it would show that unless you have, you hurt your gum or you ate something and a kernel maybe got stuck, then you bleed, that's different. Or say you ate something hot and you got burned or something, then yes, that's different than when you have that bleeding or, infection. But usually when you brush your teeth and you see that you're bleeding of your gum is a tell sign that you actually have gum disease. That's number one. You will also see that your gums are more swollen or like more red in pigmentation. Most people have like pink looking gums, depending on your ethnic group. Sometimes you would see people who have darker gum with darker pigmentation or sometimes more brown. But you will notice that it is swollen. So instead of being kind of like nerve edge, it's kind of like you have like more of a rolling of the gums. So it's kind of fatter. That's also showing that you have inflammation of your gums. Okay. And also, as I say, it becomes more red in pigmentation. Then you would also know that your gums are inflamed. Some people experience some itchiness also sometimes. That's very rare, but it can also happen where, your gums are starting to feel itchy. That can also show that, yeah, you have gum disease. But number one is when you have bleeding gum when you brush. Yes, you have gum disease more than likely.
What about with bleeding just with flossing? Because I feel like sometimes that can be not always a problem. I don't know. Like it could happen anytime. What about
You're
with
right. So yeah, so when you floss and you bleed, that's also a sign that you have gingivitis for the most part. However, it's also technique sensitive. If you
flossing?
just like wedging your floss right on the gum, yes, it's gonna cause bleeding if you actually are aggressing, your gums. So yes, that's kind of like if you're not using the proper technique, you may not necessarily have, gum disease. So that's why you need to actually know how to properly floss. But yes, usually though, it will be gum disease. But sometimes it's just that you doing it the right way. You're not flossing properly.
Okay. Yeah, I've definitely been at the dentist where I feel like they're a little more aggressive than me flossing, and sometimes I get a little blood, but I don't think they've told me I had gingivitis yet, so I
Okay.
think I'm safe.
Well, that's good.
Yeah. Okay. So obviously don't ignore if you're having bleeding gums. It's very important, right?
Absolutely.
Yeah. What are the major causes of gum disease, including maybe genetic predisposition or anything like lifestyle stuff?
So the number one reason why you would actually have gum disease is poor oral hygiene. That's
Hmm.
number one. So you're not brushing properly. You may be brushing every day, but are you brushing properly? That's the key. Just like flossing, are you flossing properly as well? So basically, what you want to do is, I mean, sometimes people just brush the surfaces, the enamel of their teeth, and they don't really address the areas between the gum and the teeth. Okay, so that's where you need to go. Yes, you need to brush really well the surfaces of your enamel to remove plaque. However, you want to make sure that you address those surfaces where food actually gets lodged, right? And where bacteria also like hide in there under the gum. So that's why when you use your toothbrush, you want to go in circular motion, but usually you want to make sure that you angulating your toothbrush at a 45-degree angle. And if you're brushing like your top teeth, so let's say, I'm sorry, I should have brought a toothbrush, but let's say this is your tooth and this is the gum area, right? So you want to angle your tooth in a manner where you kind of like sweep away the food that can get stuck there. Okay, so that's what you want to do. You want to do that for all the surfaces of your teeth, for your top teeth, for your bottom teeth, on the outside surface, the surface close to your cheek and your lips, also on the inside surface close to your tongue and your palate. And then you want to make sure, obviously, that you're brushing the chewing surfaces of your teeth. So where we see sometimes you have people who come to the office for their dental cleaning or their exam and you do the cleaning, you will see that their enamel is super clean, right? But areas between when you kind of pass your instrument close to your gum, it starts bleeding, or sometimes it even gushes. That means
Mm.
maybe that the person just brushed before they got there to the dentist, or that they don't do a proper job. They do brush their teeth, however, they don't focus on the areas between the gum and the teeth. That is where food gets stuck. That is where, also bacteria lodge there and hide. So the other thing is you also want to make sure that when you floss in a C motion. So you want the floss to actually hug your tooth. It's hard to tell, to show, but it's gonna make like a C. So you're not gonna go at your floss just straight up and down, but you
Mhm.
want to kind of shift the floss toward the surface of the tooth that you actually cleaning. So say for example, you are flossing this area of this tooth, you want to make the floss curve this way and brush that area. And on this area, the other side, you want to actually shift the floss that way. So it's going to scrape along, the curved area of the tooth. If you only go up and down, it's going to miss so many areas. And the
Mhm.
reason why flossing is important too is because the bristles of the toothbrush are too thick and they're not going to go between your teeth. And that being said, if you miss those areas, it's kind of like I liken it to like areas that are so tight. Say, for example, the little area between your fridge and the countertop. It's hard to reach there. You want to sweep, it's hard to reach. So that's the same thing. The bristles of the toothbrush typically don't go between the teeth. That's the reason why you use floss. Because I remember seeing an article, or I think it was an article saying that flossing was overrated. Well, if you think about the fact that, your toothbrush bristles are not going between the teeth, then
Mhm.
it's not overrated. And many times, when we take x-rays, we see people who have super clean surfaces of the teeth, the chewing surfaces, no cavities there, but you have so many cavities between the teeth because they're not reaching with the floss. So that's number one thing as far as trying to avoid gingivitis. You want to also make sure that you go to the doctor, you go to the dentist at least twice a year.
Mhm.
If you're just a person that have a relatively healthy gum or just gingivitis. But if you have periodontitis, then at the discretion of your doctor, the dentist will let you know when they want you to come back because then you need more professional cleanings. There's also the type of food that you can eat that can also reduce gingivitis. You have some food that are anti-inflammatory, like milk. You want to eat leafy greens like broccolis and kale and foods like carrot, celery that have a lot of fibers because they're also cleansing. Also, lots of vitamin C. It's also very good for your gum as well. So those kind of things are what is going to help you limit or decrease or prevent as well gingivitis or gum disease and periodontitis.
Mhm. So with the toothbrush, you're saying go at an angle, right? And then, so not most, but a lot of people use the mechanical one, and you can still maybe get that at an angle, right?
Mhm.
Okay.
Mhm.
And then it has a timer of 2 minutes. Do you think that's sufficient to like get all those areas, the surface of the teeth and the gum lines too?
2 minutes is recommended. Obviously, if you do more, it's not gonna hurt, but you want to do at least 2 minutes, okay? At least two
Hmm.
minutes, and you want to make sure that you address every single tooth surface. And if it's more like the technique. Are you sweeping away like the food away
Hmm.
from the gum? And so some people say even go in circular motion versus just going like that horizontally or vertically. So 2 minutes is, typically is what the ADA recommends. But if you feel like you want to go longer, that's also good. It's
Hmm.
okay, yes.
Yeah, I had accidentally had it on the clean mode of my setting, and I was going way longer than 2 minutes. And I was like, what is going on with this? Like, I am ready for bed. It was too long. And then, so my kids, they tend to just do this.
Mhm.
So they are not on the electric toothbrush yet. So maybe I need to make sure that they're doing the circular motion, like you were
Correct.
saying as well.
Correct.
And then also, I think the angle is like going to be a pretty important thing. And then the flossing, I think you were just saying it really hugging the tooth, right? And all the sides for
Mhm.
sure as well. Yeah.
Right. That's
And
correct.
then flossing, you recommend once a day?
Yes, the ADA recommends at least once a day. At least once a
Hmm.
day.
Hmm.
Yes.
And then you mentioned the healthy foods, right? So eating like an anti-inflammatory diet is,
Mhm.
very helpful for the gums
Mhm.
and stuff as well. Unfortunately, some of the things you mentioned are some of the things that get stuck in my teeth. So I would have to floss like right after eating that.
Correct. Yes. So, if you are able to floss right after to floss food out, that helps as well. Because
Yeah.
obviously, even so, when food gets stuck, not only is it uncomfortable, it can hurt, but you don't want to have food get stuck between your teeth.
Hmm.
So, yeah. So
Hmm.
if you are one of, like, for example, me, whenever I had undergone an orthodontic treatment, meaning I had braces. And there was one area that didn't close right away. I always had to floss between because when food would get, lodged between my teeth, impacted in there, it was so painful. So
Hmm.
I used for that kind of person, if you are that person, you can use floss. Sometimes floss doesn't really help if it's got a bigger gap. You can use there's some little brushes that you can find those interdental brushes, the tiny brushes that they use kind of like, those big brushes that you clean your baby bottles with. They're very tiny
Hmm.
and you can go between your teeth removing food, and that helps as well. And that's also beneficial for people who actually have braces. Then they can really go ahead and remove food and clean areas between the wire and the teeth and also under the gum. Yeah.
Yeah, that's helpful. I think, thinking back, I might have even had one of those little brushes that you're talking about when I had
Mhm.
braces many years ago.
Yes, that
Um,
came in so handy for me.
yeah. One thing you mentioned was pain, and you didn't bring that up with the sign of the gum disease. So is pain also like a sign of it? I mean, I would assume maybe with the swelling and the redness and the, bleeding that pain could come with that, but is it sometimes painless?
Most of the time it's going to be painless. That's the reason why like people don't really realize that they have any issues. So if it's actually painful, that means that in addition to just, that means it's a very severe infection at that point. Perhaps, it's so severe that you have maybe like pus there and things like that. Those are rare cases, but for the most part, people don't know they have it because it doesn't hurt. Actually, it
Okay.
doesn't hurt. Yeah.
And then you mentioned like using x-rays and stuff. So how do you actually diagnose, gum problems during, your dental checkup?
Okay, so there are two ways that we recognize that somebody has gum health. One is that whenever we do our exam, we use some tools like we use a probe. It's an instrument that has some measurements, and we are able to measure if you have pockets. So sometimes say you go to your dentist and you hear at it, since your dentist has not yet told you that you had gum disease, probably when they measure things, it's probably between 1 and 3. So you sometimes will sit there and you hear the doctor go 1, 2, 3, 4, 6, something like that. Those are the measurements that we are taking to measure if you have gum disease. So if you have just gingivitis, which is again the infection of your gum, typically it's going to be just between rarely 0, but 1 and 3. So once you start having like higher numbers, that's showing that you're starting to have some attachment. So your gum is attached to the bone, and so you're starting to have attachment loss and what we call pockets. That's more like periodontitis. So we take those measurements. We see also like the bleeding. We look at the quality of your gum, if it's swollen, if it's red. That's how we are able to tell. But also on the x-rays, you can also notice for somebody that has periodontitis, you're able to see that the level of bone has decreased.
Mhm.
So normally you have bone up until almost like the beginning of your crown. But if it's starting to be lower to where it's more like around the roots, or you see that the level has decreased, you can also say that the person has periodontitis. So that's how
Mhm.
we are able to tell.
So the x-rays also help. I was going to ask, and you may not know this answer because I don't
Mhm,
know when you did your training or anything, but
mhm,
like I don't remember ever hearing these numbers called out like in
mhm,
my prior experience with dentists until more recently. So is this
mhm.
something new, or maybe they just didn't do it, or you have any idea?
I'm not really sure because for the entire courses of my studies and beyond, we've always, measured. So I graduated in 2011, so I don't really know what happened prior to that. But from the time that we were in school, we were always measuring. So I'm not able to answer that question, but that's an interesting question, yes.
Yeah, yeah, I don't know. It's just probably me not paying
Or
attention or something when I
maybe,
was a dentist.
they measured and just didn't necessarily call out the numbers. I'm not sure.
Yeah.
That's possible too, but it's hard to tell.
Yeah, it might be that. I mean, now that everybody has like an assistant that's putting in the numbers and things like that,
Right,
I feel like.
right, right.
Okay. So, well, you find this, gingivitis or periodontitis. So then what do you do?
Once you find it, definitely you're going to let the person know. You're going to let your patient know. We go over oral hygiene instruction, just like I told you or explained
Mhm.
to you, share with you, tell them how to actually go about, conducting their oral hygiene at home. We do the cleaning, and depending on whether the person has gingivitis or periodontitis. If the person has periodontitis, then you would need what is called a deep cleaning. But if it's just healthy gum or gingivitis, we just we just do a regular cleaning, okay? And then we also polish the teeth. So we let them know, we advise them as well on how to floss, what to eat. They can use a mouthwash. Sometimes we may prescribe chlorhexidine, which is a medicated mouthwash that's going to decrease the bacterial load. It just depends on what, the findings are, but those are pretty much things that we will do in order to address that gum
Mhm.
disease at the doctor.
Yeah, I was going to ask if you needed to use any like medications or anything like that, or antibiotics or anything like that.
Yes, sometimes you may need to use, like if you see that somebody, if I see that somebody has a whole lot of bleeding, I would definitely recommend a medicated not over the counter, but a medicated prescribed antibiotic. Sometimes, a patient may need some antibiotic placed in different pockets. It just depends on what the person would need at that point. In some cases, say if the periodontitis is very severe, we may need to refer them to a specialist because they may need gum surgery, they may need gingival graft. It just depends. But for the most part, we would do it in-house. If it's too severe, then we send it to a periodontitis. There are, with periodontitis, sometimes teeth are so mobile that you may lose some teeth and then may need to extract the teeth. But it depends. It varies.
Mhm.
Yes, the course of
Yeah, okay.
action.
So general dentist doesn't do that. They would send you to the periodontal.
For depending on the dentist, if they have enough training, to
Mm.
undergo to do gum surgery, they may be able to do it. But typically in our office, we'll send it to a periodontist, which is a specialist for gums and all the structures that actually support teeth.
So we mentioned a bunch of, lifestyle things that can contribute to having gum disease, like especially the nutrition.
Mhm.
Is there anything that having gum disease can have an effect to the rest of our body?
Oh, absolutely. So having gum disease is problematic in that it can for sure affect the rest of your body. Because if you think about it, there's the same blood that goes through your gum, goes through, your bone and all of that goes through the rest of the body, right? So you can end up, and that's the reason why we stress upon that. You can end up having different problems because if the inflammation that's in your gum does not just stay at your gum and travels in the rest of your body, it can go affect your brain, it can go affect your heart. Tell the story of my uncle, for instance. He had an infection that stemmed from him having cavities, and that was back home in Congo, where we don't really have, or we didn't have the habit of going to the dentist on a regular basis, unless something truly, truly ended up hurting
Mhm.
like crazy. So he didn't go to the doctor, but when he did go, he ended up having, unfortunately, a stroke the same day
Mhm.
stemming from mouth infection. So that's why, it's very important to address that. I remember as well one of my patients that came in hysterical. She was so scared because a long time ago, she went to the doctor and she had a cleaning and she said that the same day, I believe it was, if I remember correctly, she ended up having sepsis. So it's very direct. I mean, your entire body is connected, right? So
Mhm.
infection in your mouth can affect the rest of your body. So that's the reason why you want to not neglect, your oral health, because even gingivitis or lingering periodontitis can affect the rest of your body.
Mhm. Yeah,
Mm.
so sepsis, for the listeners, is like an infection in the blood that can mess with every organ system in the body and can land you in the hospital in the ICU, even if it's, affecting you where it's shutting down organs. So very big deal that could, happen from just having, problems with your mouth. It's
Mhm.
crazy. And
Right.
I know I just a random question,
Mhm.
and just because I don't know, listeners might be interested, but why do some patients have to take an antibiotic before their dental cleaning?
Okay, so guidelines are always changing,
Hmm.
but they used to be, patient that would have maybe like a heart murmur or somebody that has just had like some organs replaced, like knee replaced or something like that. Then their physician might recommend, having antibiotic before the treatment. That way, because there are bacteria that we are actually dislodging by doing the cleaning, so it doesn't end up affecting those areas, causing problems. So that's the reason why sometimes, we may, or the physician may require for the patient to first have antibiotic before any dental cleaning.
Hmm.
There are other instances where we do give antibiotic before, and that's not necessarily before treatment, but say, for example, somebody had like a big infection and maybe a tooth needing to be treated with a root canal, or maybe, a tooth extracted, or maybe an implant placed, dental implant placed, then in those cases, we may, depending on the level of the infection that's there, prescribe first an antibiotic to get like
Hmm.
the infection in check or more contained or decreased. Because if you don't, by the time we give you anesthesia, the anesthesia is just going to get diluted. And when we try to do the treatment, the patient is still in pain because he's not able to be, or she's not able to be anesthetized accordingly. So in those instances, then we will give you antibiotics prior. You take it for at least 3 days, and then we can do the treatment to continue.
Yeah, I think patients, especially with heart valve and joint replacements and things like that, the bacteria that is in our mouths is supposedly very sticky and can stick to those things. And I think that's what can lead to, worst cases like sepsis and things like that. And I think those are some of the reasons why we do it. I mean, it's kind of what you said, but for those particular cases in general too. Yeah.
Right, right.
Cool. Well, anything else to add on gum disease that we might have left out?
I did leave out that you need to make sure you drink lots and lots of water because water is helpful. We are so majorly made out of water. But also, if you think about it, water is going to kind of dilute things. If you're drinking things that are very acidic, it's going to dilute, the acidity. It's also going to wash out a lot of, the food debris that gets stuck on your teeth and help with that. So drinking lots and lots of water is very, very essential. And it helps also with your gum disease.
Plain water. Yeah.
Yes.
Yeah.
Yes.
So I have a personal question. How long do you spend with your dental routine? Like, let's just say before bedtime, not all day.
Mhm. Yeah, so definitely I make sure that I brush, my teeth before I go to bed. And even when we say brushing, because say, for example, you are eating food in the evening, you definitely don't want to brush your teeth right after have finished eating, because there's still a lot of acid on your teeth. And if you brush right away, you can actually start causing erosion. So you want to wait at least 30 minutes. After that, you want to make sure that you do brush for at least 2 minutes as recommended, and that you floss. I prefer flossing at night
Mhm.
because then I have a clean surface. Because at night, we have a decreased salivary flow, and the saliva helps a lot as far as making it a little bit more difficult for bacteria to adhere to your teeth. So at night, since we produce less saliva, your bacteria have an easier time actually adhere to your teeth. So flossing during those times to me is also very, very helpful to floss at night. Obviously, as we say, it's at least once a day. So if you're able to floss in the morning as well, it won't hurt.
Mhm.
Yes.
What is your take on flossing before you brush or vice versa?
Man, to me, I think it'll be more helpful to do it after, because that's, after, well, obviously I do brush before, right? Because when I wake up, I brush my teeth, or even in the evening flossing. But I think that it's going to be more beneficial to do it after, because then you would actually remove the food that you have just eaten as well. That would be maybe stuck also between your teeth. So I think evening, but it's up to you.
Yeah, yeah.
Yeah,
So I meant
I
flossing before
think
you
after
brush.
eating. Mhm.
You floss after you brush?
I do. I
Okay.
floss after I brush, but some people say to floss before.
Yeah.
I do like to floss after.
I think I used to do that. And then I have, tight teeth, so I get things stuck. So I feel like I need to floss before so I can actually brush those surfaces. Otherwise,
Gotcha.
it's just stuck.
Right, right.
Awesome.
Mhm.
Yeah. Well,
By the way,
awesome.
there was a question that you
Yeah.
asked me last time that I had to go and check, and it was about mechanical toothbrushes or electric toothbrush for kids. When was or what was the
Oh,
age?
yeah.
And it's 3 years old is what is recommended.
Oh, okay. I'm way behind then. Time to upgrade my kids' toothbrushes.
Yes.
That's going to be a pretty penny. Okay. Actually, are the cheaper ones that they sell at like Walmart in the bins, like that spin for kids, good enough? Or do they need like a advanced one, like
I
a
mean,
Voldy or
I
something?
think that the thing with electric toothbrush is helping as far as, because the children don't really have good dexterities. I think that if you can get that, that's good. But if you can get
Okay.
one that's better, why not,
Mhm.
right? But
Yeah, yeah.
yeah, that's what I think because a manual one will help as well. So if you go with
Mhm.
an electric one, it's only going to just be better as far as, helping. And especially if you are able to get one, because kids they rush really quickly. So if you're able to get one that has a timer or that has a
Mhm.
song, they become more interested in
Yeah,
actually using it. So,
that's a good idea. Yeah.
mm,
Awesome. Well, thank you so much for all of your, expertise again on and coming in on the podcast today. I definitely learn something every time, so it's so fun. Thank you so much.
thank you
And
so much for having
everybody,
me
yes.
again.
Yeah, everybody, tune in next week to see what we bring for you and please, subscribe, like and all that stuff too. All right.